Well, here at Park City Medical Center, I think the biggest advantage and difference we have is that we have everything under one roof. We have a great physical therapy department that includes PT, OT. We have an aquatics program, so we have a pool. It's called a SwimX. And then right across the hallway we have doctors, orthopedics. We have an ER, so we get a lot of variety of patients. We're lucky here at the Medical Center because we're new. We had the opportunity to research and buy all new equipment to meet the needs of the physical therapist and the occupational therapist. One of our growing populations is joint replacements. We see a lot of post-op knees and joint replacement therapy, which is a completely different population, although in this community is a very active population. So we have a total joint program that starts from the inpatient and extends all the way to outpatient. We have arthritis type programs for hands. We have a spine program for back and neck therapy. This is Hillary. A year ago, Hillary had bilateral knee surgery to realign her patella. It's called a proximal distal realignment. And just a few weeks ago, she had another surgery to clean up the cartilage behind her kneecap and remove all the hardware from the first surgery. So here we have her doing just a body weight exercise, working on balance and some strength. She's standing on 2 discs that are called Dyna discs, and the Dyna discs are on a vibration plate. Here Hillary is doing a core exercise, incorporating her legs, transferring and shifting weight, but the main focus of this exercise is actually her core. So when we rehab athletes, we don't focus just on their injured part, but on their whole body. So this is called the Shuttle Balance. It's another piece of balance equipment, and it can be made, you can make the exercise more difficult or easier by moving these chains and the cords that attach to the platform. So here, since Hillary is in one of her early phases of rehab, we're going to keep the chains into an area where it's not too difficult, but she is on one leg, so it's not easy by any means. So the important thing about this exercise for Hillary is that she had her patella realigned so that it would track better in her femur. So for Hillary, when she balances, her focus is keeping her kneecap over her second toe, her knee slightly bent, and her hip in alignment. So she's engaging all those muscles to hold her leg in proper alignment. And with Hillary, the one thing we want to look for is that her kneecap is not diving towards her other leg, that her knee is not caving inward. So we can make the exercise more difficult by distracting her, but she's doing very well. But you can see, when the exercise gets difficult, you can see which direction her knee does go. It wants to go towards the other leg. So that's what we're trying to get her to work on. So here we have our SwimX. And the reason why we use a pool for rehab is because you can allow people who are non-weight bearing to exercise in a partial weight bearing environment. We can also do exercises to progress from weight bearing to completely loaded for those patients who aren't ready to run or jump or explode. We can do them first in the water so there's less stress across the joint and on the tissues. So it's a very safe environment to progress people to land activities. We have cameras so that our clients can see what they're doing if we're trying to improve their gait, trying to improve how they walk to get them to walk normal again. If we're trying to work on technique, they can perform the exercise and then view it on the video screen so that we can correct their technique. One of the common injuries we see in the winter is the ACL reconstruction. And those come in varying degrees of straight ACLs, ACLs with meniscus repairs, ACLs with MCLs, ACLs with bony damage, and again, they're all treated depending on the severity of that injury. The more damage, usually the longer the rehab is. If it involves cartilage, whether it's bony cartilage or meniscus cartilage, it takes a little longer to rehab than a straight ACL. But typical therapy, the first 2 months of therapy is getting their range of motion back, getting rid of their swelling, getting them to walk normal again, regaining all of their strength and balance so that they can return to their prior level of function.